John Maxwell gave a lesson entitled Simple Works. And I always try to present things simply. I spent the last 12 years trying to prevent bioidentical hormone replacement in a simple way because if I present it in a simple way, it works. I started presenting stress in a simple way, GI in a simple way, practice management in a simple way, because simple works. But simple doesn't come easy. Just because it's simple doesn't mean that it's easy. Simple means that we make it easy to understand. And that's what Dr. Dunstan did tonight. We're going to make weight loss easy to understand. And I tell you, if you come to American Functional Medicine Association, we're telling every speaker, you have got to give these doctors who attend simple information that works. What does work mean? It means that it's consistently effective and practical. Weight loss is practical, her program is effective. So she qualifies. All right. So she's going to bring information that's simple and it works. Now, there's three types of things. There's simplistic, there's complexity, and there's simple. Simplistic is fast and shallow. You don't need progesterone if you don't have a uterus. See, that's simple. It's fast, but it's shallow. And if you've ever heard one of my lectures, that statement is not true. Simplistic gynecology. I used to call it gynecology made simple, but it's actually simplistic gynecology. And then in honor of Dr. Dunstan tonight, calories in, calories out. That's simplistic, that's fast, but it's shallow. It really has no meaning. And so you don't want to practice simplistic medicine, but that's what most physicians practice is simplistic medicine. You've heard me talk about this. This is gynecology in a simplistic way. You ask a patient how old they are. Young patients get birth control pills. Older patients get hormone replacement. Anybody can get an antidepressant, and if it doesn't work, you cut it out. That's simplistic gynecology. And because a deep understanding of gynecology is complex, most docs don't go that route and they would rather practice simplistic gynecology. And because most physicians practice simplistic gynecology, it becomes the standard of care. What is the standard of care? What are most reasonable physicians doing in your area? And that's what most reasonable physicians are doing. So it becomes standard of care. And if you do something different, any different, you are considered to be outside of the standard of care. Complexity is slow and deep. This GYN endocrinology book takes a long time to read, is very deep, is very detailed, but that is the complex problem. That's the complex part of this problem. The key is you've got to take the complex and dwindle it down into something simple. Simple is fast and deep. I think that entire book comes down to this statement: the ultimate biological response reflects the balance of actions of the different hormones with their respective receptors. That whole book points to this statement. We want the ultimate biological response. You have to balance the actions of the hormones. You have to measure the hormones so you can balance them. You have to measure them where the action is, and you have to use hormones that you have receptors for. That's hormone replacement by the book. You can do the same thing when you're talking about the gut. The ultimate biological response reflects the balance of actions of the different bacteria and enzymes and the amount of absorption. Everything has to be balanced. The action of the gut has to be balanced. The action of the adrenal gland has to be balanced. So we do it, we funnel down that complex book and we bring it to this statement, which is fast, but it's deep. And that's what the American Functional Medicine Association wants to do, is to bring complex issues to you and allow you to make them simple so that you can think of them fast and you can have a deep understanding of what we're trying to do. Einstein says we cannot solve our problems with the same thinking we used when we created them. So we don't want to have simplistic understanding because that created all kinds of problems. Calories in, calories out. You don't need progesterone if you don't have a uterus. That's simplistic thinking. Simple, ask no questions. You go through residency, you do what your chief resident said. No questions asked. Complexity asks many questions. And that's what we've got to do. We've got to start asking questions about those simplistic thoughts. Simple answers questions. My goal when I get done speaking is that there's no questions, because I want to have answered all the questions that you may have had and given you simple answers. If you ever been to my conference, I say, hey, look, you measure the hormones. If it's high, you lower them. If you low, if they're low, you raise them. We answered the question about how do you practice hormone replacement therapy. So simple answers questions. Review. Simplistic is fast and shallow. Complexity is slow and deep. Simple is fast and deep. Simplistic asks no questions. Complexity asks many questions. Simple answers questions. Simplistic embraces the popular. Complexity embraces frequency, and simple embraces proven. So what is popular? Simplistic is fast and shallow. Simplistic asks no questions, and simplistic embraces popular. The result of simplistic is interest. People notice, but they don't change. This is my great quote that I always say at all of my seminars. The problem with popular thinking is that it doesn't require you to think at all. It's easier to do what other people do and hope that they thought it out. That is the result of simplistic thinking. Complexity is slow and deep. Complexity asks many questions. Complexity embraces frequency. When you go through that complexity process where you understand it for yourself, you get integrity. People who go through this process find truth and reality. Dr. Dunstan has done that. She spent a lot of time and energy with me asking me a bunch of questions, and now she understands it and she has integrity in what she does. Don't believe a word I say, look it up yourself. Things work out over time, but not every time. You have to do it. Dr. Dunstan didn't just sit and listen. She went and did it. She did it for herself. She did it for her patients. Because things don't work out every time, but they work out over time. In the beginning, we don't do well. In the beginning, we don't have total understanding. Excellence is doing something enough times that you do it well. Wisdom is doing something enough times that you understand it. Okay? Simple is fast and deep. The result of simple is value. People understand and experience growth. That's what I want you guys to do, is to grow into the people and the doctors that you are supposed to be. Simple works, simple is accessible and reproducible. You can do this. The mission of AFMA, or the American Functional Medicine Association, is to present simple works information. Information that is simple, that you can have a deep understanding of, that is fast, and you go and practice it, and you'll gain more and more understanding, and it allows you to grow into what you should be.